You may be contemplating having dental implant treatment done, or you may even be having it soon, and the dentist or the implantologist may have suggested that you will need to have a bone graft in conjunction with your treatment. So the question you should be asking is, do I need to have a bone graft, and why do I need to have a bone graft? A bone graft will add and can add substantially to the cost of the overall treatment, and it can also lengthen the treatment. Not to mention that complications can arise from having a bone graft done, which can actually ultimately cause the implant to not succeed. In order to understand the relationship of bone grafting and implants, we're going to look at a simple model of a healthy tooth. So imagine a block of plasticine, and imagine a Lego brick. With the Lego brick held vertically, you press it halfway into the plasticine. So that represents, the Lego brick represents a tooth. The bit that you can see is the bit of a tooth that you can see in your mouth. The other half, which is inside the plasticine, represents a root of a tooth, which you cannot see because it's covered by the bone and the gum. The plasticine represents the jawbone, so the tooth is held tight by the jawbone. Now imagine your tooth is being taken out. So imagine lifting the Lego brick out of the plasticine, and you end up with a hole there. Immediately after you lose a tooth, the blood clot fills into that hole or that gap. Over the next few weeks and months, that space where the blood clot is at the moment will eventually form into new bone. There is, however, a big however, and that is that new bone, the amount of new bone will never ever be the same amount as the original bone that you have lost as a result of having the tooth out. But in many cases that doesn't matter, because the remaining bone is, or should be, enough so that you can place a dental implant. The dental implant must be surrounded by bone all the way around. So you can have a situation where there isn't enough bone, and you can have not enough bone in one of two ways. Firstly, the width might not be, you call it the socket width or the ridge width, it might not be enough, so that the implant is too wide for the socket, and therefore the implant cannot be placed because there won't be bone all the way around. Secondly, there may not be enough bone height, so although the implant can go in, there won't be enough bone to cover all of the implant. As well as losing bone when you first have a tooth out, the other crucial element to this is that over a period of time, forever, you will continue to lose bone from that site where there is no tooth. This will continue for the rest of your life. At first, the amount of bone you lose is quite fast, but over a period of time it does slow down, but it never totally stops. That's the reason why, if you need to have an implant done, it's best to have an implant almost as soon as you can after you have lost a tooth. Even better still, you can have an implant at the same time as when a tooth is taken out. This is called an immediate implant. An immediate implant therefore gives you the most chance to preserve the maximum amount of bone for an implant. It's not always possible to do an immediate implant. For example, if there's infection there, you have to wait for the infection to clear up first. This process of where the bone is being lost is called bone resorption, and it's a term where your dentist may use. Now, certain factors will increase your likelihood of needing a bone graft. A bone graft is something that a dentist can place to replace or add on to your existing bone in order to make the implant fully embedded within bone. Obviously, a bone graft is a separate procedure, but sometimes it can also be carried out at the same time as when the implant is actually placed itself. It all depends on the clinical situation. So let's look at factors which increase the need or increase the likelihood of needing a bone graft. We've said already that when you lose a tooth, the process of bone resorption starts. So the sooner you can have an implant done after a tooth extraction, generally the better it is, because you are reducing the chances of more bone being lost. Most teeth that are extracted are due to gum disease, and when you get gum disease, you know that your teeth become loose and you become long in the tooth. The reason for that is, going back to the plasticine and Lego model, is that in gum disease the bone or the plasticine around the brick starts to disappear, and that's why a tooth will become loose, and that's why you look long in the tooth as well. If you know you have got gum disease, therefore you should try to minimize the gum disease so you do not lose any more bone, or if it is going to be a fact that you are going to lose your teeth, it is therefore better not to delay that process where the gum disease destroys all of the bone. If the gum disease does destroy all of the bone, then it can make it difficult or even impossible to have any bone grafting done. The third common scenario where a bone graft is needed is where a tooth is infected. Where a tooth is infected because, for example, of an abscess, then the infection surrounding the tooth causes bone resorption. It actually destroys the bone around the tooth. So if you've got an infected tooth, it's better to have this treated or to have the tooth taken out in order to prevent unnecessary bone being lost and resorbed. So we've spoken about what happens to the bone around a tooth once a tooth is lost, and we've also spoken about factors that increase the bone loss around a tooth once it is lost, and how to minimize this. In another talk we'll mention about the different types of bone graft and what can go wrong and alternatives. Thank you.